So can you talk about the nature of the collaboration between IUP, IRMC, and Takara Bio, and how has that gone?
It has been a very, very good experience for me. And coming from a big school like University of Florida after my postdoc, and coming to a university like Indiana University of Pennsylvania that is sandwiched between Pittsburgh and UPMC and Penn State, it was very important for a state system school to establish itself in research, at the same time contribute to the community. And it was a natural, I will say, natural experience for me in the sense that I wanted to give back something to the Indiana community because my family has grown up here. Two of my daughters went to high school here and they went to school at IUP, and they're all excellent physicians, and one is going to be a physician. So it was both personal and at the same time very important for me to contribute to the community. The collaboration, I will say, is just fantastic in the sense that IRMC really accepted the technical know-how and easy availability of knowledge, the knowledge source, and capacity to help Indiana Regional Medical Center. And it was very critical as a scientist for me to tell the university and to tell IRMC that I worked very closely with Takara Biosciences, and Takara participated equally well in this process, and that partnership is key to development of any answer to a pandemic like this that could have global implications, because the university is a public university. It's a public state system school nested in a rural area, and IRMC is a rural community hospital. And for Takara Biosciences to participate in this partnership is the best thing that could have happened in a pandemic like this.
Well, totally. I come from a small town in North Lake Tahoe called Truckee, California. And there's about 30,000 people that live there. Probably there were half as many people when I was growing up. And, even now, my family who still lives there has been trying to get tested for COVID at various times in the past year. And they've had to wait week and a half or more to get their test back. And by the time that's happened, I mean, so much can happen, right?
Right.
So it hasn't been very useful for people in rural communities because of, I guess, the backup, and these time-consuming steps. So hearing that there is a way now for these smaller communities to more cost-effectively test people and do it faster because the sample extraction step is eliminated. That gives a lot of hope, that people can get the information they need to make decisions about their lives, whether to go back to school, whether to go to work, whether to see family. That impacts everyone in their daily life. So for me, it's so exciting to be, even peripherally, kind of reporting on the work that you guys and Takara are doing together. It's so exciting and fulfilling for me. So thank you for your work.